In today's video, I'm going to be discussing obsessive-compulsive disorder. I chose this disorder because of how common it is, yet there are only 2 successful treatment plans. In this video, I will cover what OCD is, some of the symptoms and behaviors of OCD, how it's diagnosed, and how it can be treated. What is OCD? Obsessive-compulsive disorder is an anxiety disorder where people have unwanted and recurring thoughts. These thoughts cause the patient to do something repetitively. 1% of the US population has some form of obsessive-compulsive disorder, and gender does not play a role in the cases in the US. However, in countries like India, women are more commonly diagnosed. What are some of the signs, symptoms, and behaviors of obsessive-compulsive disorder? The most common symptoms are phobias and fear of losing control, agitated behaviors, and social isolation. Behaviors vary between sociological groups. For example, in India, behaviors include taboo thoughts and mental rituals. For example, fasting. Commonly, people with OCD will have at least one other psychological disorder. This is referred to as OCPD. People with OCPD report lower rates of inflexibility. This means that people start focusing more on the second disorder than they do on the OCD. However, at the same time, people with OCPD were found to exhibit higher rates of hoarding and bipolar disorder. In order to be diagnosed with OCD, a patient must undergo a psychological evaluation. During the evaluation, the therapist will look for 3 major things, such as obsessions, like being a perfectionist or having germophobias, compulsive issues, like turning a light on and off 3 times before you can leave the room, having a certain knock that you have to do every time you knock on a door, or washing your hands in a specific way for a specific amount of time in order to feel like they're clean. The third thing that the therapist will look for is whether the obsessions and compulsions take too much time and get in the way of the person's values, such as their family, work, or school time. Nature does play a role in people with OCD because some of their behaviors are based on the wiring of their genes. Nurture plays a role in OCD when ritualistic behaviors stem from childhood experiences. For example, making yourself stop and take extra time at a stoplight or stop sign before going because you were involved in a car accident when you were a child. Treatments for OCD include the 2 following: psychological evaluation and counseling. This is where a therapist will dig to find the causes of the obsessions and compulsions. Once the cause is found, the therapist will then come up with a treatment plan and rehab therapy, and this treatment is found to be 75 to 85% effective. The second treatment is selective serotonin reuptake inhibitors. These are also known as antidepressants. This medication is combined with talking and cognitive behavioral therapy. There's currently no data supporting whether this is effective or not because it does not actually treat this condition, it just helps maintain it. Taking this psychology course, I have learned a lot and it has helped me understand mental health behaviors. This is going to help me not only in my career in the health field, by making me understand our patients and being able to see signs and symptoms, as well as some of the behaviors that are underlying in some of the mental health issues and disorders. But I will also be able to take this outside into my personal life. I'll be able to help people in my community, as well as teaching my children how to understand, help, and focus on people's disorders as well.